Assalamu alaikum.
Alaikum assalam.
It's great to see you guys here. Thank you for joining us for the health podcast. Cool. So to start off with, Sister Ghazala, could I please ask you to introduce yourself and let us know about what you do?
Absolutely, yeah. So my name's Ghazala Chowdhury and I work for an organisation called BHA for Equality, who are managing the project which is called Answer Cancer. So Answer Cancer is the Greater Manchester Cancer Screening Programme, and the aim of the project is to basically work with disadvantaged communities and to try to raise awareness about cancer screening, so in turn to increase the uptake of cancer screening across Greater Manchester.
Okay, and Sister Faiza, could you quickly introduce yourself and let us know what it is that you do?
Yeah, of course. So my name is Faiza Chowdhury. We're not related, by the way. And I work for MFT, the NHS, and my role is Cancer Screening Improvement Lead for breast screening for the whole of Greater Manchester. I also work alongside Ghazala at the Answer Cancer Programme as an engagement lead as well. So I do a bit of community work and a little bit of strategic work as well.
Right, so the NHS currently has a programme for screening for cancers, and one of the main ones is breast cancer. Could you tell us a bit more about that screening?
Yeah, absolutely. So we have 3 NHS cancer screening programmes. It's breast screening, cervical screening and bowel screening. So today we're here talking about breast screening. So breast screening starts for women from the age of 50 onwards, and they're invited through the NHS every 3 years to come for a mammogram, what's known as a mammogram. And that letter will come to you automatically. So the advice is that when you're invited for your screening programme is to, attend. Now we hear all sorts of reasons why women are not attending their screening programme. So just an example, I hear this all the time. I'll meet women and I'll say, did you go for your screening programme? And they'll say, no, we got the letter, but I was just afraid. I was afraid of what I was going to find out. I was afraid because I heard that it's really painful. Numerous reasons why people don't attend. So the idea behind the work that we do is to, try to allay people's fears, try to sort of give them more information about the whole process, what it involves, and the importance of obviously going for your screening. This whole idea of that early detection can potentially save your life. So Faiza, do you want to just talk through the actual process?
So when we talk about screening, just so if people understand what screening means, it means that we're looking for something. So obviously the NHS screening programme, as Ghazala said, is for people aged 50 to 71. You have to be registered with a GP as female. You automatically get invited every 3 years. And what that's doing is we're checking for any cells that are changing or just change that you couldn't normally feel or see yourself. So really, in theory, it's for healthy people, but actually we don't know what's happening inside. So if you have found a lump or you found a rash or any of these things that Ghazala was mentioning earlier, then we wouldn't tell you to come for your screening appointment. Even if you had a screening appointment in a day's time or 2 days' time, we'd say always go to your GP and go through the 2-week pathway. So the whole idea is you have a mammogram. A mammogram is like an X-ray that they do. So the important things to say, it's women only, because a lot of people say, they think that they're going to go and there's going to be other, other health professionals there.
Always a female.
Yeah, so there's the whole thing is just women only. So the mammographers are female. You'll go in, it's a 15-minute appointment. It's not like going to the hospital where you have to wait like 5 hours for an appointment. You'll go in and it'll more or less be at that time. So the whole idea is they'll scan both breasts, but we're also scanning your collarbone and underneath your armpit. So they'll move you around a little bit to make those, but generally 15 minutes all in all. So when you first go in, they'll do a questionnaire with you just to find out what your history is, make sure we've got the right person, and then they'll take you across. A lot of women feel a bit kind of embarrassed, a bit shy, the fact that obviously they have to wear nothing on their top half. but it's so close, so you'll be in the changing rooms, and literally you just walk out and you'll be in the room. So you're not walking around like that. You're it's just a little bit of a walk to the machine. The actual machine, we do 2 X-rays on each breast, and then obviously we'll move you around to make sure we've got a clear picture. It's an automatic pressure of flattening the area so we can get a good picture. Some people say they can't take the pain because everyone's got a different pain threshold. It shouldn't be painful. It just should be uncomfortable. So if it's too painful, we can do it manually. We want to get that pressure because we want to get the right shape, the right images, but we'd rather have a image than no images at all. So as I was saying, so if people are scared, as you just said earlier, because it might hurt, actually you can, do it manually. The other important thing to mention about screening, it's a choice. So you don't have to go to it, but it's a life change. It's potentially life changing. So people should go to it. So we need to make sure that people have got the right information before they go to screening to make that informed decision of whether they want to go or not. And because it's a choice, at any point within that whole process of when you even turn up for your appointment, you can stop it at any point. And I think that's really important to let people know, because they're in control, and people feel when they go to these appointments that they're out, they can't control that. But even if you're there and you're on the machine, if you're feeling uncomfortable, you can say stop, and they will stop at that point, and you don't have to carry on. But that doesn't mean just because you stopped at that point and you've left that you can't remake an appointment.